There's a letter that could be in your mailbox right now, and it says the hospital that you've trusted for years won't take your health insurance anymore. This year, dozens of America's biggest hospital systems totally walked away from Medicare Advantage plans. Mayo Clinic, Johns Hopkins, even the big hospital that half of New York depends on. By the way, I'm a little sick today, so please bear with me. But so many older adults have been asking me about this that I wanted to get this video out today. The government says the market is stable, but the hospitals are telling patients to just run. And there's one mistake seniors are making when you try to switch that locks you out for the rest of your life. So I'm going to tell you today how to know if you're at financial risk and exactly what to do to protect yourself. I'm Neal K. Shah, a Johns Hopkins and NIH-funded caregiving researcher and the CEO of CareYaya. I've helped thousands of families navigating aging, dementia, and serious illness. I'm not a clinician, but a caregiving researcher, and my job is to tell you what's happening before it catches you by surprise. I've also helped thousands of people fight health insurance denials, so this topic is important and very near and dear to me. I even wrote a best-selling book about it and how our health insurance system is so broken. I think we really have to reform this system. But back to today, here's why I think it really matters to you. Most American seniors are now on a Medicare Advantage plan, and the ground is shifting quickly underneath those plans right now in ways that they don't want to warn you about. So please do this first, by the way. If someone you know or love is on Medicare Advantage, please send them this video today. I think this is a conversation that could keep a family from losing their doctor and their savings. Now, the timing here is really cruel. 61 years ago, on July 30th, 1965, President Lyndon Johnson signed Medicare into law. He flew to a small library in Missouri to hand the very first Medicare card to Harry Truman, the former president who'd fought to pass Medicare and lost that battle 20 years prior. The promise on the card was very simple: grow old, get sick, and we'll take care of you. 61 years later, today, I think that promise is being broken. Not by the government, but by these private Medicare Advantage plans that now cover more than half of America's seniors. Because a plan is only as good as the hospitals that take it. And this year, the hospitals suddenly started saying no. And here's a number that I think should be on the evening news and isn't. Becker's Hospital Review, which is the hospital industry's own leading publication, counts roughly 25 major health systems that have dropped or significantly narrowed Medicare Advantage this year. The list is still growing. And I'm not talking about random small town clinics. These are the names that you drive to across the state or even across the country to reach. Mayo Clinic left most Advantage plans from UnitedHealthcare and Humana. UNC Health cut Humana, WellCare, and the old Cigna plans. And one of them hit close to home for me as someone who runs research through Johns Hopkins. Johns Hopkins Medicine went out of network with UnitedHealthcare's Advantage plans. So think about it. When Johns Hopkins and Mayo both walk away, I think that's a pattern worth paying attention to. And another big one is unfolding right now. New York Presbyterian, one of the biggest hospital systems in the country, has been in a standoff with UnitedHealthcare over its Medicare Advantage members. They've hit a deadline and then pushed it back 6 separate times. As of now, the next cliff they face is at the end of August. If they don't sign a deal, hundreds of thousands of seniors could wake up to find their hospital suddenly out of network. So imagine an elderly woman living by herself, waiting to find out if her hospital still takes her insurance. The question many people are asking me is, why? Why would a hospital turn away these patients? Well, hospitals give 2 reasons. The Medicare Advantage plans are dragging out payments, and they're denying patient care far too often. Under the original government-run Medicare, a hospital does what it needs to do for the patient, sends the bill, and just gets paid. It's very simple. But under many of these for-profit Medicare Advantage plans, the hospital has to beg the insurance company for permission first. That's called prior authorization. And then still often fight to get paid after they deliver the care. And the number of times it hears no is absolutely shocking. The American Hospital Association says Medicare Advantage plans deny these requests at rates that are up to 6 times higher than regular Medicare. One health system recently in Oregon put real numbers on it. Its denial rate under Medicare Advantage, 22%. Under traditional Medicare, 1%. When doctors appeal those denials, most of them get overturned. So everyone knows the actual care was actually necessary all along. The denial didn't really protect anyone. It just delayed the care and made someone fight for it. To be fair, it's also a two-sided fight. Insurers say they have to keep the payment sustainable, and sometimes it isn't the hospital walking away at all. Sometimes the insurer cancels the contract, and the hospital may want to stay. But either way, you as the patient are the one stuck in the middle, and you might get screwed. Here's why I think this fight feels like a betrayal. Back in 1929, a hospital in Dallas offered local school teachers a deal. 50 cents a month, and if you land in the hospital, you're totally covered. 3 out of 4 teachers signed up. That small plan grew into what we call Blue Cross today. It was a start of hospital insurance in America. The whole idea was a partnership. Hospital and insurance on the same team, both trying to get you cared for. Unfortunately, what you're watching play out in 2026 is that partnership is completely falling apart, and your letter is sitting in the middle of that divorce. So how do the officials describe all this? The federal agency that runs Medicare projects that the 2026 market will stay stable. Steady premiums, plenty of choices. I think, yes, on a spreadsheet, that may be true. But a spreadsheet doesn't feel the consequences when your hospital exits your insurance plan. By one estimate, nearly 3 million Medicare Advantage members were forced to change plans for 2026 because their plan pulled out, shrank, or cut their benefits. I think that's a massive population of seniors suddenly starting over. And if the hospitals are running from these plans, here's what you should be doing. There are 5 moves you can make. And by the way, miss the last one, and none of the others can actually save you. First, check now. Don't wait for the letter. Don't assume your doctors are covered next year just because they are today. So this fall, read the notice marked Annual Notice of Change. Or call your hospital and ask, by name, which plans they'll still take next year. 2, know your escape hatch. When a plan drops your whole hospital network or leaves your area completely, you can qualify for a special enrollment period. That's a chance to switch outside the normal fall window. You may not have to wait and suffer. Call 1-800-MEDICARE and ask in these words, does this qualify me for a special enrollment period? 3, ask for continuity of care. If you're in the middle of treatment, like going through chemo, a surgery, or a recovery, you have the right to keep your doctors in network for a transitional period, even after the contract ends. Don't let anyone tell you that care stops the day the contract does. Say the words continuity of care. 4, get free and unbiased help. Congress created counselors called SHIP, S-H-I-P. They sell nothing and earn nothing from your choice. Find yours at shiphelp.org or call 1-800-MEDICARE. A lot of these Medicare help phone lines out there are really just salespeople paid to sign you up to a private plan. So start with SHIP, where no one profits from your decision, and therefore they can be unbiased. And 5, the one move you must make before you flee. Let's say your hospital drops your plan, so you decide to jump back to original Medicare. That's a good idea, but original Medicare has no limit on what you can pay out of pocket. So almost everyone needs to add a supplement called Medigap. But here's the catch. In 46 states, you only get one guaranteed shot to buy Medigap without a health exam, a 6-month window when you first turn 65. Miss that and insurers can charge you more or can just turn you down flat based on your health conditions. Here's what I think that means for everyone. The very reason you want to leave, that is if you got sick, is the reason they can shut the door on you. Only 4 states protect you no matter what: New York, Connecticut, Massachusetts, and Maine. Everywhere else, you need to plan for this before you get sick. That can save you thousands of dollars. So right now, if you know one person deciding on plan options, please send them this video before they make a move that they can't undo. I think this is like a 10-second share that can prevent a 10-year regret. And before you make a single change to a plan, ask a SHIP counselor one question. If I switch, can I still buy Medigap in my state, and will I pass? Take one last look at that library in Missouri when they passed Medicare this time of year back in 1965. An 81-year-old former president holds up a card that says number 1. He was the first patient. And the promise is simple. You'll grow old, you'll get sick, and we'll take care of you. Here we are 61 years later. That promise is being fought over in boardrooms that you can't see. You can't make Mayo Clinic and UnitedHealthcare shake hands. You can't force your hospital to stay. But you can decide one thing: whether that cancellation letter catches you flat-footed or whether you already know your window, your rights, and your first move. So don't let the mailbox decide your healthcare. Check your plan, know your escape hatch, protect your Medigap door before you need to walk through it. If this helped inform you, please do 2 things for me. Subscribe and follow so you hear about these changes before they can impact you. And please send it to an older adult out there who needs to understand this. because I think the person who watches this is the one who doesn't panic. I'm Neal K. Shah. Thank you for watching, and let's help look out for each other.